Chronic obstructive pulmonary disease, or COPD, is a chronic inflammatory lung disease, and it causes obstructed airflow from the lungs. Symptoms include breathing difficulties, cough, mucus, and wheezing. Studies suggest that people who are experiencing a flare-up of COPD tend to have lower levels of vitamin E than people whose COPD is stable. Other studies suggest that long-term use of vitamin E supplements may help to prevent COPD. For best results, take mixed tocopherol, which are a combination of different sources of vitamin E. They could be a mixture of alpha-tocopherol, beta-tocopherol, gamma-delta tocopherol, which are all natural forms of vitamin E. People with chronic obstructive pulmonary disease can reduce some of the symptoms by taking a regular dose of vitamin D. That's according to a new study published in the journal Thorax. In order to determine your dose, get a 25-hydroxy vitamin D blood test and then supplement accordingly with D3 to correct any deficiency. Vitamin K2 works synergistically with vitamin D3. Consumption of vitamin K is associated with a reduced risk of developing emphysema. Chronic obstructive pulmonary disease, comprising of emphysema, and chronic bronchitis are the most common chronic respiratory diseases that impart a huge economic and clinical burden. A maximum amount of vitamin K2 that your body can absorb daily is 300 micrograms, so a dose higher than this would not be needed. Get your K2 in the form of MK7. A vitamin A deficiency promotes and aggravates pre-existing inflammation. Previous studies have demonstrated that a risk for chronic obstructive pulmonary disease increases with decreasing levels of blood vitamin A. In addition to the importance of this vitamin for the lung function, vitamin A is also responsible for the development of many tissues and cells, as well as for the embryonic lung development. Vitamin C has symptom-relieving effects on the exacerbation of COPD. In addition, it improves pulmonary function in COPD. Moreover, a recent animal study has revealed that supplementation of vitamin C not only prevents the development of COPD, but it also restores the lung function in COPD subjects. The best form of vitamin C is liposomal. A next best form would be a non-acidic buffered vitamin C, with the worst kind being cheap acidic ascorbic acid. Bioflavonoids possess both antioxidant and anti-inflammatory properties, and hence they can influence chronic inflammatory diseases like COPD. Oxidative stress is an important feature in the pathogenesis of COPD. Targeting oxidative stress with antioxidants or boosting the endogenous levels of antioxidants is likely to be beneficial in the treatment of COPD. They help to improve the action of vitamin C, therefore they make a good combination. One popular flavonoid is quercetin. In a preclinical model of chronic obstructive pulmonary disease, COPD, the quercetin reduced the markers of both the oxidative stress and the lung inflammation, and also reduced rhinovirus-induced progression of the lung disease. Quercetin, the bioflavonoid, as well as enhancing vitamin C, also enhances zinc. Vitamin B12 deficiency is a real problem in COPD populations. Take B12 in the form of sublingual methylcobalamin for best results, if B12 injections are not available to you. You should note a B12 blood test can fail to detect a B12 deficiency due to food now being fortified with folate, and this folate in the body throwing off the test results. As B12 is water soluble, it is excreted daily and considered very safe. The anti-inflammatory and antioxidant properties of garlic are beneficial to people with conditions like asthma, bronchitis, and, as per a few recent studies, garlic has protective effects on even a lung cancer patient, to an extent as it might work as a chemo-preventative agent. It may also help to kill any bacterial infection that could occur when someone is suffering from COPD. The body naturally produces coenzyme Q10, an antioxidant that's been studied for its potential role in battling cardiovascular conditions and even cancer. Also available as a supplement, coenzyme Q10 may also have a merit as a natural remedy for for COPD by helping to increase cell activity and to ease inflammation. In trials, doses of 300 to 500 milligrams per day were needed to see results, usually in the form of ubiquinol. Coenzyme Q10 works synergistically with PQQ. Typical doses range from 20 to 40 milligrams per day. Pyroquinolone quinone, or PQQ, a bacterial synthesized quinine, is a strong redox cofactor with multiple biological benefits, including antioxidation, anti-cancer, anti-inflammation, the modulation of mitochondrial metabolism, and neuroprotection. As both PQQ and CoQ10 work on improving the mitochondria, you can see my other video on mitochondrial boosters for more options here. Omega-3 fatty acids may reduce bacterial lung infections that are associated with COPD. Compounds that are derived from omega-3 fatty acids, like those found in salmon, might be the key to helping the body combat lung infections. This is according to researchers at the University of Rochester School of Medicine and Dentistry. The researchers found that higher omega-3 intake was associated with fewer severe COPD exacerbations, better symptom control as indicated by validated patient response measures, and a trend towards higher lung function. Typical doses of an omega-3 EPA DHA fish oil blend can be 3 to 9 grams per day. Cordyceps sinensis is a complementary medicine used for chronic obstructive pulmonary disease. It's known to improve athletic performance by increasing the oxygen in your blood and making it easier to breathe. Researchers at Guangzhou University of Chinese Medicine conducted a study of 15 high-quality studies that involved 1,238 COPD patients, and they found that cordyceps significantly improved lung function, exercise endurance, and quality of life, with no report of any serious adverse effect. Another herb with a similar benefit is haritaki, one of the most popular herbs in Ayurveda, as it's said to balance the three doshas, Vata, Pitta, and Kapha. It's renowned for its ability to increase blood oxygen levels by up to 300%. Some research shows that taking echinacea along with other supplements like zinc, selenium, and vitamin C may ease cold symptoms that in turn may help with a flare-up. The combination of echinacea, zinc, selenium, and vitamin C may alleviate exacerbation symptoms caused by upper respiratory tract infections in COPD. Further studies are warranted to investigate the interactions among echinacea, zinc, selenium, and vitamin C. You could take 50 milligrams of zinc picolinate a day and eat 3 Brazil nuts to get your required daily amount of selenium, which is 200 micrograms. Elecampane root, or Inula helenium, is a herb that's used as a dietary supplement for various health conditions. It's native to Europe, where it has a long history of use, and it's also used in traditional Chinese medicine. Elecampane root contains active compounds with anti-inflammatory properties, which can help to treat inflammation-related respiratory diseases. One review of over 120 studies suggests that elecampane has antioxidant activity that may help to fight oxidative stress and inflammatory diseases, including cancer, impaired brain function, and diabetes. Elecampane root has a long history of use in the reduction of coughs and respiratory-related conditions like arthritis, bronchitis, and throat infections, particularly in folk medicine. One test tube study found that lanoloctone isolated from elecampane suppressed airway inflammation resulting from cigarette smoke exposure, as well as helped open airways. The authors even suggested that the lanoloctone is a potential therapy in chronic obstructive pulmonary disease, chronic inflammatory lung disease that often results from smoking and makes it difficult to breathe. Test tube research has also observed that elecampane can slow white blood cell activity and reduce inflammation in respiratory conditions. Products that are currently available suggest taking a half to 1 gram of elecampane root per day. This can be boiled as a tea. The growing amount of data from pharmacological and animal studies suggests the notion that curcumin can play a protective role in chronic obstructive pulmonary disease, acute lung injury, acute respiratory distress syndrome, and allergic asthma. Doses can range from 2 up to a maximum of 5 grams per day. Due to its low bioavailability, its absorption can be increased with bioperine, which is black pepper extract, or consuming it with a fat such as butter, ghee, coconut oil, or fish oil. Probiotics may be useful in COPD patients, particularly those with frequent viral infections. A diet supplemented with Lactobacillus plantarum prevented cardiovascular disease in smokers. Berberine effectively alleviated lung injury by reducing lung edema and neutrophil infiltration. Berberine also significantly reduced histopathological inflammatory changes via inhibition of endoplasmic reticulum stress and the activation of NRF2. In trials for blood sugar, 500 mg of berberine hydrochloride is taken 3 times per day. This may also have life-extending possibilities, as you can see from my other video on life extension and my video on the anabolic triad. Berberine is considered to be the active constituent in Goldenseal, the popular herb for the immune system. A traditional lung tonic contains the 2 herbs ivy and thyme. A German study found the unique mixture of essential oils in thyme improves the clearance of mucus from the airways in animals. It may also help the airways relax, improving airflow into the lungs. Whether this translates to real-life relief from the inflammation and the airway constriction of COPD remains less clear, but it might be worth a try. In a study, glutathione levels were shown to increase in stable COPD patients and heavy smokers, and it was shown to decrease during the severe and very severe exacerbation periods. Sputum glutathione levels were high in COPD patients. Ways to increase glutathione are by taking reduced glutathione at 1000 mg per day, 500 mg 3 times per day of the glutathione precursor N-acetylcysteine, and the herb milk thistle, and also ensure that you get your daily selenium of 200 micrograms per day, or 3 Brazil nuts. Eat 20 to 30 grams of fiber each day. Eat a good source of protein at least twice a day to help to maintain strong respiratory muscles. Be sure to avoid dairy, as this may create excess mucus and make it harder to breathe. Sleep troubles are common in people who suffer from COPD. People who have a hard time breathing at night due to COPD may wake frequently and have trouble falling asleep or staying asleep. Overall, reduced sleep time and sleep quality may occur. Check out my other video on herbs to help you sleep and my video on melatonin for more information. The enzyme Serrapeptase digests mucus from within, reducing the amount of mucus in the lungs, without the sufferer needing to continuously bring it up. It's a common favourite for chesty coughs and blocked sinuses, but also recommended for long-term use to sufferers of COPD. For more information about the herbs or supplements mentioned in this presentation, go to my website.